Now, as a firm, we've worked in this space since the early days of the changes in regulation and the creation, I guess, moving from the MMAR growers that existed for personal medical growing to ACMPR through to the current licensing regime. And what I've seen is over that time, there has been, I guess, a lack of clinical research that existed to give comfort for both regulators in licensing products on the pharmaceutical side or the medical side, but also to doctors to prescribe. Tell us a little bit about that evolution and your role in it.
Sure. Basically, when we started our clinical research, so since 2016, the company has done 5 clinical trials. We've completed 4 of them already. So we're probably one of the most advanced companies in the world developing cannabis prescription drugs. Back before the legalization, it was a simple world for us. We were developing cannabis as any other drug. So basically just like morphine when it was an investigational drug. It went through, we had to work with the Controlled Substance Division of Health Canada, the Office of Clinical Trials, and then if the evidence was there, it would get approved. Right. Post-legalization, life changed for the whole industry. It was supposed to make, how could I say, life easier for physicians and companies like ours, where you would have to get approval from the Office of Clinical Trials like before, so that hasn't changed. But the Office of Controlled Substance lost the responsibility of cannabis. It basically got shifted to the whole cannabis group. Mm-hmm. Because of short staffing, we went from a delay of being able to start a trial from 2 to 4 weeks post-trial approval to get what we call the Section 56 to now over 6 months delay to get a trial up and running, which is now a lot slower than the U.S. Drug Enforcement Agency. So it's pushing companies like ours to reconsider their business model and consider moving certain of our, strategies to the U.S. and even to Europe.